As people live longer, their health and social care needs become more complex. They evolve and change. The NHS is changing too, and adapting to better meet such needs. This short film, produced by the Kingsfund, shows how health and social care services are trying to work closer together to provide more effective, patient-centred care centred around your needs.
Over the next 20 years, the number of over 85s in the UK will more than double, meaning many more of us with multiple long-term health conditions. Our current health and social care system won't cope. Fundamentally, it's the same system as when the NHS was set up, designed to treat episodes of illness one at a time. Already we're failing to give vulnerable people the care they need, and we're set to run out of money fast. Meet Sam. He's 87 and suffers from emphysema, a disease that makes it hard to breathe, and also has type 2 diabetes and arthritis. Sam was coping pretty well until his wife passed away, but is now lonely and increasingly depressed. Sam frequently visits his GP, but finds it difficult to discuss all his needs in a brief consultation. If Sam can't get hold of his GP in a crisis, he calls for an ambulance. Each time, Sam spends time in A&E, and is often transferred to a ward as well. He sees lots of different healthcare professionals and has to explain his conditions repeatedly. Frustrating. And Sam often has to wait to be assessed by social services before he can go home. The result? A lot of unnecessary time in hospital. And when he gets home, a lack of coordination between his GP and social care often means he doesn't get the support he needs. Eventually, after several hospital visits in just 6 months, it's decided to admit Sam to a care home. But what if Sam's health and social care services were more joined up? Let's imagine one of Sam's carers is given overall responsibility for coordinating his care. For example, Kathy, a district nurse. Kathy meets with Sam, his GP and his social worker. Sam explains that he wants to manage his conditions at home, and together they design a care plan which they can all access online anytime. Sam now gets more visits from Kathy at home, which helps him manage his emphysema and diabetes. On the occasions when he does have a crisis, Sam calls Kathy rather than an ambulance, so goes to hospital less frequently. And even when he is admitted, he's discharged after a quick review of his care plan rather than having to be reassessed. In this scenario, Sam's health and social care is funded from a joint budget, so the team can make smart decisions about how it's spent and call on the help of other social services. For example, as his condition deteriorates, the team decide to fit a seat in Sam's shower, provide him with an oxygen cylinder to ease his breathing, as well as a medication dispenser with a voice prompt to remind him to take his pills. Kathy talks to Sam about his loneliness, and he agrees to weekly trips to the shops with a volunteer from a local befriending charity. So now, Sam doesn't have to be admitted to a care home, instead getting the help he needs in his home. He feels happier, is healthier, and better use has been made of resources within the system. Let's recap on what transformed Sam's care. Put simply, local leaders in the NHS, social services and the voluntary sector created a shared vision of what good, integrated care looked like, centred around the needs of people like Sam and their carers. They pooled resources across health and social care, built multi-professional teams and created systems to allow Sam's information to be easily shared. Sound idealistic? Well, this is actually already happening in a few places. Now it's time to make sure it happens everywhere. Let's reimagine how we provide care. Get inspired at kingsfund.org.uk/joinedupcare.
So, what does this mean for you in Exeter? The city is home to a growing population of about 140,000 people. It has pockets of deprivation, areas of wealth, a thriving student population, as well as older communities. The city is served by one hospital, the RD&E, with its busy accident and emergency service, the Exeter Community Hospital at Whipton, 18 GP surgeries, out-of-hours services, and more than a dozen pharmacies. Residents also have access to a wide range of community healthcare, including occupational therapy, physio, community nurses, and voluntary sector services. Every day, dozens of ambulances crisscross the city, conveying people to hospital. As the Kingsfund clip shows, not all of these trips to hospital are necessary. Demand for NHS services is on the rise, but unfortunately, health budgets are not increasing. Doing nothing is just not an option. Things have to change. We are trying to provide better services for the same amount of money. We have some ideas about what could be done, but no decision will be taken without you. That's why in Devon, and of course in Exeter, we are looking at how healthcare, social care, and the voluntary sector can work closer together. We are looking at what can be done to make sure services are local and tailored to meet people's real needs. For instance, one idea which has already been successfully tried in other parts of the country is to open up community health and wellbeing centres. These hubs provide a social focus in a welcoming environment where people such as Sam and his carers could have their health and social needs met. Before we do anything, we need your views and feedback to help us shape the future of health and social services in your area.